I extend a big thank you to all our staff, volunteers, and clients for another great year at CMHA Peel Dufferin. With a new strategic plan to guide our work in 2016-17, we focused on the plan's three priorities: enhancing access to services, expanding our continuum of services for mental health and addictions, and developing our workforce so we can continue to support the best outcomes for our clients and community.
The year was one that could be split into two halves. The first half was highlighted by the addition of the new Dufferin CMHA resources and implementing our new resources from the LHIN. Dufferin resources transferred to CMHA Peel on July 1st, and the organization was thrilled to be able to now offer services across the entire Central West LHIN and to welcome our great new colleagues from CMHA WWD. The transfer came with a change in our name to CMHA Peel Dufferin and allowed us to introduce new resources in family and addiction services for Dufferin residents and to begin planning with our new local partners.
The second half of the year was the first period in several years without major investment to drive CMHA's work, and was used as a great opportunity to fine-tune the operational side of the organization, move forward on our strategy, and to implement our ambitious continuous improvement and quality program.
The first major operational change was the introduction of some new staff-level reporting. These reports allowed staff to see all of the great work they had done and to ensure that what was recorded in our system matched what they knew about their work. The organization also benefited from the formal introduction of several new processes to save time on non-value-added activities. This meant less work for staff on timesheets, greater capabilities to work remotely, higher quality mobile phones and SIM cards, and policy changes to facilitate staff spending more time in the community supporting clients and less time traveling. Together, these changes led to a 7% increase in reported client visits per staff. The last few years have seen CMHA Peel Dufferin continually improve its management capabilities in order to better deliver quality and efficiency projects. This year saw those efforts formalized into a continuous improvement program that takes ideas submitted by staff, of which this year there were over 30, prioritize them, and stream them to any one of 5 quality improvement methods. Managers and staff have been trained in business process improvement, PDSA cycles, lean, project management, and business case development in order to effectively turn ideas into quality improvements. Additionally, 14 of our managers have now been trained through the LHIN-sponsored Rotman Advanced Health System Leadership Program to increase the tools at their disposal to bring new thinking to healthcare. This all led to projects to implement structured psychotherapy, implement new models in justice services, improve telephone support, formalize orientation and training, develop and improve models of family support, implement new groups for waiting clients, improve mental health outcomes through physical activity and meditation, and many, many other improvements.
The organizational focus on diversity and equity has taken several forms. We continue to hire from a wide variety of backgrounds with staff now able to work in 19 different languages. The entire organization has again undergone cultural competence training, and the agency also participated in the Central West LHIN's Health Equity Data Collection pilot project, which saw staff trained to improve data collection based on the social determinants of health. Our quality improvement plan delivered measurable improvements in access for diverse populations, and 183 calls or visits were supported through the use of translation and interpretation services. Staff also supported the arrival of Syrian refugees, offering training, building partnerships, and directly reaching out to offer family support. Better serving the needs of our diverse clients and their families remains a vital organization focus.
The organization made other great strides in giving our employees the support they need to meet new challenges in mental health. Following on last year's cross-organizational training, 21 new staff were trained in compassion fatigue and almost 50 in suicide intervention. Yet further increasing skills through staff training in complex trauma, trauma recovery, trauma fundamentals, sexual trauma, clinical supervision, and mindfulness. Individual employees and teams were also recognized through our awards program. These awards acknowledge and celebrate employee innovation, leadership, teamwork, and spirit. And staff awards were handed out at our annual Branch Staff Team Appreciation and Recognition Day in January.
2016-17 also saw the board and the agency as a whole take on greater role in advocating for increased funding and improvements to the mental health care system. This work included a coordinated campaign with CMHA Ontario and other branches, as well as meetings and presentations to federal MPs and provincial MPs, as well as municipal councils. In February, we were pleased to see the Ontario government announce a new investment of $140 million in mental health and addictions across the province. And in March, it was announced that the federal government and the province had reached a new funding agreement on the Health Accord. The new Health Accord includes $1.9 billion of new funding over 10 years for mental health and addictions in Ontario.
CMHA Peel Dufferin's strategic plan outlined 3 goals: improve access, expand and improve our continuum of services, and to develop the workforce to meet these goals. As you can see from our expansion into Dufferin County, improved access for families, clients with addictions, and diverse populations, as well as the increased family services and trauma-informed interventions, we have delivered on these goals across the whole organization. As we move into another year, I hope you are as excited as we are to continue our work for greater access, greater support, and greater impact.